Hello everyone, this is Dr. Madhusudan Rao on the program I teach medical students. Today I am going to touch briefly on speech. Speech is assessed as a part of the clinical examination of the nervous system and it is considered to be one of the higher intellectual functions. Speech is evaluated in terms of comprehension, fluency, emotionality, and associated neurological deficit. Before we touch on the problems of speech or disorders of speech, let us briefly touch on the anatomical aspects of speech. Speech has got two centers. One is speech receptive center, another is the expressive speech center. Signals of sound, sound stimulations, sound stimulus are received by the primary auditory area in the temporal lobe, which receives the impulses from the auditory nerve. That means cochlear part of the vestibulocochlear nerve receives the signals from the organ of Cartier and it takes the impulses to the primary auditory area. Primary auditory area receives these sound signals from the environment and also the signals of spoken language. Sounds of the language sounds as well as the non-language sounds are received by the primary auditory area, and it is a primary auditory area cannot interpret the sound stimulus, either it is a language sound or the environmental sounds. It sends this signal to the auditory associate area. It is auditory associate area where the interpretation of the language sounds occurs and the individual can comprehend the language. Okay, it is the auditory associate area interprets the language sounds that is similar to the vernix area for spoken language. In the same way, we have got the visual center for the visual stimulation. Primary visual center receives the signals of vision and in turn sends to the visual associated area. Interpretation of the visual stimulation is the function of the visual associated area and so much so the vernix area for the written language. So receptive centers for the spoken language and the receptive centers for the visual written language lie with the is the responsibility of the vernix area. Okay, that is similar to the visual associated for the written language and the auditory associated for the spoken language. So ultimately it is the vernix area in the dominant hemisphere that is responsible for the interpretation of the spoken language sounds or the written language. What is the dominant hemisphere? It is said to be left hemisphere for the right-handed persons and also 2 to 3% of the left-handed persons dominant hemisphere is the left hemisphere. It is only the 0.5 to 1% of the individuals with left-handedness, the right hemisphere considered to be the dominant hemisphere. Okay. The functions of the language, the receptive or the expressive, lie with the dominant hemisphere. Then coming to the expressive speech center. What is the expressive speech center? Broca's area. Okay. Okay. Let us go to the some diagrammatic representation of the speech centers. This diagram shows the cerebrum. It has got the frontal lobe, parietal lobe, temporal lobe, and occipital lobe. Below is the cerebellum, pons and medulla. This picture shows primary motor area in the precentral gyrus, primary sensory area in the postcentral gyrus of the parietal lobe. You have got the posterior speech area. It is called the vernix area. The anterior speech area, that is the Broca's area. If you look at the hemisphere, you have got the frontal lobe anteriorly, parietal lobe posteriorly, occipital lobe posteriorly, temporal lobe inferiorly. There is central sulcus of Rolando that divides the frontal lobe from the parietal lobe. Parietal lobe, parieto-occipital sulcus divides the parietal lobe from the occipital lobe, and there is a lateral sulcus that separates the frontal and parietal lobe from the temporal lobe. Then you see with regard to the speech centers, there is a vernix area that is part of the temporal lobe, part of the parietal lobe, and is also close to the occipital lobe. This area is considered to be the vernix area that receives the signals from auditory associated area and the visual associated areas. Okay, this is responsible for the interpreting the sounds of language and the signals received from the written language. Visual stimulations of the written language and the sound stimulation of the spoken language. Okay, they are received and interpreted by the vernix area. Okay, the vernix area in the dominant hemisphere is responsible for the interpretation of these sounds, language sounds, and the visual stimulus of the written language. That's how it is. Then coming to the expressive center for speech. This is the function of the Broca's area for expressive speech. Where is it located? It is located in the posterior part of the inferior frontal gyrus and inferior part of the premotor cortex. This is the area that is responsible for the nerve cells for the lips, mouth, tongue, for their motor activity. Okay, so ultimately it is the action of the motor system, that is motor activity, that is responsible for the expression of the language skill. So these are the anatomical considerations of speech function with regard to the receptive speech center and the expressive speech center. And the problems related to the speech and language or the result of vascular lesions in these areas, especially involving the dominant hemisphere. Okay, what is the blood supply of these areas? Arterial blood supply is through the carotid system for the anterior part of the brain, by the vertebrobasilar system for the posterior part of the brain. Well, it is the Broca's area is supplied by the branches of middle cerebral artery. Okay, while it runs in the lateral sulcus, it gives away branches to the Broca's area and other parts of the cerebral hemisphere of hemisphere, except the area supplied by the posterior cerebral arteries. What is the middle cerebral artery territory in the cerebrum? It is the most part of the frontal lobe, most part of the parietal lobe, and most part of the temporal lobe, except an area superior part of the temporal lobe, superior part of the frontal lobe, and superior part of the parietal lobe, and inferior strip of the temporal lobe below the inferior temporal sulcus. So that is the middle cerebral artery territory. So any lesions involving the branches of the middle cerebral artery can affect the language function, either the receptive or expressive. So when the speech disorder is disturbed due to the lesion in the higher centers, that particular disorder is called dysphasia or aphasia. That means disturbance associated with the speech function due to the involvement of the higher centers is called dysphasia or aphasia. So it could be receptive aphasia or expressive aphasia. Okay. If the lesion involves the vernix area in the dominant hemisphere, it is called receptive aphasia. If the lesion involves the speech expressive center, it is called expressive aphasia. Look at this. So speech disorders are divided into aphasia and dysarthria. Aphasia is because of the lesion in the higher centers involving the organization of the language, okay, which in turn expressed as the speech. The disorder involving the organization of the language, so causing the problem with regard to the speech, it is called aphasia. In a simpler word, central lesion causing the speech problem is called aphasia, and the peripheral lesion causing the articulation of the language is the dysarthria. Okay. Well, aphasia again divided into receptive aphasia and expressive aphasia. Receptive aphasia is due to the lesion in the vernix area of the dominant hemisphere. Okay, it is further divided into word blindness and word deafness. What are the features of receptive aphasia? Number one, this is because of the lesion involving the receptive speech center or the vernix area in the dominant hemisphere. Okay, then number two, comprehension is disturbed. There is no comprehension, but the patient is able to hear the spoken language sounds. He is able to hear what you are talking with regard to the spoken sounds, but he cannot interpret the language. Okay, so comprehension is affected. Okay, then fluency is intact. The patient speaks fluently, but it does not carry any meaning about the phrases he is using. There is a flow of the language is not affected, but the spoken language does not carry any meaning with regard to the receptive aphasia. This is called word salad or jargon speech. But what happens most of the time in the examination when the student is asked some question, he does not understand what the examiner is asking. So that means comprehension is lost, but fluency is not affected. That means jargon speech is the manifestation of receptive aphasia. And there is no emotional disturbance. It is associated with the dyslexia or alexia. Okay, it is also associated with the problems of echoencolia and problem with regard to the finger counting. Sometimes patient also exhibits aproxia. That means inability to perform a voluntary act on command in the absence of motor weakness. So what are the features of receptive aphasia? Comprehension is intact, fluency is not affected, there is no emotional disturbance, and it is associated with dyslexia, alexia, or acalculia. And the lesion is in the parietal lobe involving the vernix area in the dominant hemisphere. Okay. Then coming to the word deafness. The patient is able to see the written words, but he cannot understand the meaning of the written language. He starts reading from left to right, right to left, but he cannot comprehend the phrases that are written in the language. Okay, this is called a word blindness. Inability to see and understand the written language, even though he is able to see the rest of the world. In the absence of blindness, if the patient is unable to comprehend the meaning of the words, it is called word blindness. Right. This is a receptive aphasia related to the written language. The lesion is in the vernix area and part of the visual associated area in the dominant hemisphere. Then coming to the expressive aphasia. Expressive aphasia is due to the lesion in the Broca's area of the dominant hemisphere. that is left hemisphere. Comprehension is intact. He is able to interpret the spoken language or the written language. Okay, but he is unable to speak or express what he has to convey to the persons. Okay, when you ask something to the patient, patient is able to understand what you are talking about, but he is unable to respond fluently. Okay, it is difficult for him to find the words in order to answer the question. So, as he is unable to respond to the question or to the language sounds, despite the fact he is able to hear everything, he breaks down emotionally. There is emotional liability in the lesions of Broca's area involving the expressive language. So, what are the qualities of the expressive aphasia? Number one, comprehension is intact, expression is affected, fluency is disturbed. Okay, there is emotional disturbance. It is associated with the apraxia. That is again inability to execute the voluntary act in the absence of paralysis. And agraphia is another manifestation of expressive aphasia. The lesion is because of the infarct in the area supplied by the middle cerebral artery. And these patients usually suffer from the contralateral spastic hemiplegia, contralateral hemianesthesia, depending upon the extent of the lesion involving the hemisphere. Okay, and also they suffer from conversions if as the lesion involves the cortical cells in the motor area. Then there could be global aphasia. Global aphasia is the meaning of disturbance in the receptive centers as well as the expressive center for language. Global aphasia. Conductive aphasia. Conductive aphasia is due to the lesion in the arcuate fibers that sends the impulses from the receptive center to the Broca's area of the dominant hemisphere. Okay, here the manifestations are the same. Is a part of say for example, manifestations of the receptive aphasia. That means he is able to receive the signals of the language, he is able to understand. That is, comprehension is intact in conductive aphasia because signal from the receptive speech center are not reaching the expressive center for the speech, that is Broca's area in the dominant hemisphere. So, in this, comprehension is intact, but the fluency is affected. The lesion is in the arcuate fibers running from the receptive speech centers in the vernix area to the contralateral Broca's area. The, and what is transcortical apraxia? This occurs as the lesion in the corpus callosum. Okay. Here what happens? The impulses received by the receptor speech center are easily transmitted to the ipsilateral cortical center for express speech, but they cannot reach the contralateral hemisphere because of the involvement of the crossing fibers in the corpus callosum. This is called transcortical apraxia. Okay, he can execute the actions, motor functions by the right half of the body, but he cannot execute with the left half of the body. Okay, say in the transcortical cortical apraxia, you give a command telling the patient lift your left arm. This stimulus is reaching the vernix area in the dominant hemisphere. Okay, the left hemisphere is responsible for the motor activity of the right half of the body. Okay, because it is from the left hemisphere, vernix area, the impulse is going to the left hemisphere. Okay, so he can execute the functions of the right half of the body. But the crossing fibers, that is left hemisphere, from the left hemisphere to the right hemisphere, are blocked. Right hemisphere is responsible for the movement of the left half of the body. So, when a command is passed asking the patient to move his left arm or left leg, he can listen to the language sound but cannot execute the action of the left half of the body. This is called transcortical apraxia. Okay. In conductive aphasia, the lesion is in the arcuate fibers. That is directly going to the ipsilateral hemispheres. Okay. And in transcortical apraxia, the lesion is occurring in the corpus callosum, that is the fibers crossing to the opposite half of the body, opposite half of the cerebral hemisphere. Okay, contralateral cerebral hemisphere. Right. That's how the dominant hemisphere is functioning in terms of receiving the speech signals, either the spoken language or the written language, and signal is not able to reach the right hemisphere in order to execute the motor reaction of the left half of the body. This is what happens in the transcortical apraxia. Okay, is this clear to you? Yes. This is about the dysphasia or aphasia in its classification with regard to word blindness and word deafness, expressive aphasia, global aphasia, conductive aphasia, and transcortical apraxia. Okay. Then coming to the speech problem secondary to the disturbance in articulation of the language. This occurs because of the involvement of the motor fibers that innervate the muscles of articulation required for the expression of language. That is, muscles of articulation of language. Well, this is again divided into, this is called dysarthria. Dysarthria is the disturbance in the articulation of the speech mechanism. Otherwise, it is the peripheral mechanism that is disturbed in order to express the language in the form of speech. So that is called dysarthria. It is again due to cortical, pseudobulbar, bulbar, cerebellar, or dysphoria. Dysarthria is divided into cortical dysarthria, pseudobulbar dysarthria, cerebellar dysarthria, and dysphoria. What is cortical dysarthria? This is because of the weakness of the muscles required for the articulation of the speech. The lesion in the motor area involving the nerve cells that innervates the muscles of the tongue, lip, okay, in order to produce the speech. So cortical lesion is resulting in the dysarthria is associated with the lesion in the motor cortex in the primary motor area, and it manifests as, besides the dysarthria, it manifests as the convulsions, okay, and other involuntary movements due to the lesion in the motor area. Pseudobulbar, that means wherever the lesion, there is associated disturbing the language, the expressive language, it is associated with the other features of that particular function of that particular area. That means when there is ischemic injury to the motor cortex, there is a likelihood of presence of seizures. So cortical lesion is characterized by the presence of seizures and the weakness of the muscles innervated by the nerve cells of that area. So for example, there is a cortical dysarthria. Cortical dysarthria is due to the involvement of the facial area into the motor cortex. Okay. What is pseudobulbar palsy? Pseudobulbar dysarthria. The lesion is not in the cortex. It is somewhere below the cortex, that is involving the supranuclear fibers of the motor cranial nerves that innervate the muscles of articulation of speech. The lesion is usually bilateral, thereby resulting in the pseudobulbar dysarthria. Okay. Pseudobulbar dysarthria is characterized by the spastic speech. That means when the patient is asked to say British Constitution is a British Constitution. So that's what the example that is given for the testing of the pseudobulbar dysarthria. The bulbar dysarthria is secondary to the involvement of the motor cranial nerves in the brain stem. Okay, it is due to the lower motor neuron lesion affecting the muscles and innervation of the innervation by the motor cranial nerves. That results in the paralysis of these muscles of articulation. Thereby, the patient is unable to produce the language sounds. Cerebellar dysarthria. It is associated with the lesions in the cerebellum, cerebellar hemispheres especially, and cerebellum is connected to the muscles of articulation of the language through pons. Okay, the motor nuclei of the cranial nerves receives the fibers from the cerebellum. They in turn innervate the process of articulation of language. So cerebellar dysarthria is associated with the staccato speech. There is, I mean, what you call expressive, explosive type of language sounds, because there is no voluntary control, there is no smooth execution of the muscular voluntary act, especially the sports. That means speech also. In addition to the voluntary actions, which are uh, associated with the in coordination with regard to due to the cerebellar lesion, speech is also is affected because of the there is no smooth execution of the voluntary contraction of the muscles. That results in, as you see, there is in cerebellar lesions there is dysmetria and dysdiagodocokinesis. That means there is no control of the range of action of the voluntary muscle contraction. So when the range of motor activity is disturbed, so the degree of or smoothness in the pronunciation of the language, that results in the explosive speech, who does not carry any meaning in terms of clarity. There is no clarity in terms of the phrases or the language spoken by the individual with cerebellar lesions, cerebellar dysarthria. Dysphonia is due to the lesion in the vocal cords. There is hoarseness of the voice because of the paralysis of the vocal cords, right? So these are the various types of speech disorders. Central lesion is resulting in the aphasia. Peripheral lesion, disturbance of the articulation of the language. That is called dysarthria. Dysarthria could be again cortical dysarthria, pseudobulbar dysarthria, bulbar dysarthria, cerebellar dysarthria, or the dysphonia. So how they are tested, how they manifest, as hope the students could understand. So the talk that I have delivered to you through this video. And coming to the non-language communication skills. That means so far we talked about the language, speech, speech associated with the linguistic skills, speech in the form of the expression of the language the individual knows about. Okay, that means the individual speak about the language he knows about, and speaks in that particular language. That's how he communicates with the linguistic sounds. The individual can also communicate with the non-linguistic methods. What is the non-linguistic speech? Communication expressed by body language, that is gestural language. Okay, this is the function of right hemisphere. Right hemisphere is responsible for volume of your sound, modulation of your sound and the language, and the expression, facial expression associated with the speech, and say modulation. Say the sound is variable and melody of your speech is also a function of right hemisphere. So that means modulation of your language, melody of your sound, the degree of sound. That means loudness of the sound and the expression in terms of angry, anger, or soft. These are the qualities of the non-linguistic speech. Okay, this the function of the right hemisphere lies in completing the or giving quality or beauty to the linguistic communication. Linguistic communication will be expressionless and it will be having no quality in terms of giving beauty to the communication unless right hemisphere performs its functions in terms of modulation, melody of the spoken language. Okay. Then what are the problems associated with the right-sided lesion with regard to the speech and language? Number one, prosody of speech. That means the prosody of the speech. Prosody means what? Prosody is uh, prosody is as you said is the modulation of the language and degree of sound, degree of loudness in the language, and other characteristics of the language described as the prosody of the speech. Prosody of speech. If there is no prosody for the speech, language is monotonous. Okay, it does not carry the modulation in the expression of the language. So, lesions of the right hemisphere is associated with the eprosody. Okay, even though the individual listening to the language or the speech of an individual, he does not know the language, but still he can understand the meaning of the speech. The way the pattern of the individual is speaking. Supposedly you are viewing a picture in the cinema theater. You went, that is of different language. Still you cannot make out the meaning of the language based on the expression of the individuals or the body language of the individual. Though the language you do not know, by means of the expression and the modulation, the meaning of the speech can be deciphered. That is called prosody. And so the lesions of the right hemisphere is in eprosody. Next, what is the other function of the right hemisphere? Other one is the uh, say, for example, macro structure processing. Macro structure processing is the function of the right hemisphere again. If the individual is asked to look at a car and give the name of the object, he says it is, he cannot say it is car. He says tires, windshield, door, bonnet, etc. Inability to assemble the macro structures together and name the object is due to the lesion of the right hemisphere. The next, prosopagnosia. Prosopagnosia is inability to identify a previously known person by looking at his face. He knows that particular individual for decades from his childhood. Now the same person comes to him. The patient is asked to identify that person. But he cannot make out due to the lesion in the right hemisphere. Then the attention span. The attention span is a function of right hemisphere. Right hemisphere functions in order to maintain the long attention span. That means the individual can concentrate on a particular action for a long time, but the attention span or longevity of the attention span is disturbed in right hemisphere lesions. The next one. Okay, these are certain of the functions of the right hemisphere. So, right hemisphere with regard to communication skills cannot be ignored. So, right hemisphere is as important as the left hemisphere for the linguistic communication. The non-linguistic communication is the function of the right hemisphere. Hope you people could understand, and you can apply this particular information given to you with regard to the speech disorders and speech mechanism and the functions of the role of the left hemisphere and the right hemisphere in terms of communication skills. Okay, thank you for patient listening. Hope my video is interesting to you, and if you like the video, please subscribe to my channel, and we'll meet again in the next class. Until that time, bye bye.